Geriatrics with Brandy Jones. Geriatrics, the branch of medicine dealing with the elderly and the problems of aging. Geriatric patients generally are over the age of 65. Procedures on the population are increasing. The population is increasing by 2030. 85 years old and over increases by 21%, meaning most patients will be 65 years or older. It is important for radiographers to understand geriatrics for successful procedures. Gerontology, specialized field for the aged, includes illness prevention, illness management, health maintenance, and quality of life. Aging, the human body undergoes normal physiologic and anatomic changes as it ages. These changes do not occur uniformly in all people. Lifestyles, cultures, hereditary factors all contribute to the aging process. Demographic and social effects of aging. Research has shown that several factors affect the quality of aging experience: gender, race, ethnicity, and social class. Culturally, aging and treatment of elderly are determined by the ethnic group. Economic status of the elderly is varied. Important influence on health and well-being. Single and minority elders are more likely to have income at or below poverty level. Results which equal unwilling to spend money on what others consider essential to well-being. Effects of aging: physical, cognitive, and psychosocial. Physical effects. Most common health complaints of elderly are weight gain, fatigue, loss of bone mass, joint stiffness, and loneliness. Physical effects. Exercise is key to reducing balance, coordination, strength, and reaction time, all decrease with age. Sight, hearing, taste, and smell also decline with age. Physical effects. It is helpful to provide one instruction at a time, to reduce background noise, to speak slowly, distinctly, and directly to the patient. Not all elderly patients are hard of hearing, so adjust your volume as needed after assessment. This means the pitch of your voice. Cognitive effects caused by disease, aging, and disuse. Fears of cognitive loss, especially Alzheimer's disease, are widely spread among older persons. Dementia is a progressively cognitive impairment that eventually interferes with daily function. Alzheimer's disease is the most common form. Psychosocial effects. Positive attitude is a key aspect to healthy aging. 1 in 5 persons over the age of 65 shows signs of clinical depression. Successful aging is linked to greater social contact, health satisfaction, and fewer stressful life events. Psychosocial effects. Factors that increase the risk of depression and decrease self-efficacy. Illness, medical emergencies, fixed income, few choices in personal living arrangements, changing roles from independent to dependent. It is helpful for radiographers to understand losses, social and physical, that elderly have dealt with. Be kind. Integumentary system. First, apparent signs of aging. Skin membranes flatten and become more vulnerable to abrasions and blisters. Skin becomes wrinkled and thinner. Gradual loss of function in sweat glands and skin receptors, which increases the risk of heat stroke. Decrease in fat pads on the feet increase foot conditions. Graying, thinning, and loss of hair. A technologist must take extra care as the skin becomes more fragile as it easily tears and bruises. Integumentary system. The most common skin diseases are herpes zosters, which is shingles, malignant tumors, and decubitus ulcers. Most common skin tumors: basal cell carcinoma, malignant melanoma, and squamous cell carcinoma. Changes in the head and neck. Presbyopia is age-related farsightedness. Tear production increases or decreases. Cataracts, distorted color perception, decreased ability to adapt to light changes. Hearing impairment is very common. Kyphosis. So rapid changes in light from the bright lights in the waiting room to the dark X-ray room may cause vision issues. Assist so no falls, speak in good tone, and do not yell. Sensory system disorders. Decline in sensitivity to taste and smell, decrease in number of taste buds, decrease in saliva, and dry mouth cause taste loss. Hyposmia is loss of smell, accounts for decreased appetite and irregular eating habits. The pulmonary system decreases with age, lung capacity diminishes, cough reflex becomes less effective, a normal respiratory defense loses their effectiveness. More respiratory system disorders. The lungs lose elasticity, decreases oxygen and carbon dioxide exchange. Breathing muscles and rib cage stiffen, so it increases shortness of breath. Respiratory system diseases that increase in frequency with aging: emphysema, chronic bronchitis, pneumonia, and lung cancer. Cardiovascular system disorders. Damage to this system affects the entire body. Cardiovascular disease is the most common cause of death worldwide. Loss of arterial elasticity increases systolic blood pressure, which is greater risk for heart disease and stroke. Postural hypertension is the fall of blood pressure when rising from supine to standing. Congestive heart failure is the inability of the heart to propel blood at sufficient rate and volume. Cardiovascular system disorders. Atherosclerosis is fatty plaques in arterial walls, predominant change in blood vessels, increase in aneurysm, increases blood clot formation, complications are embolism, heart attack, and stroke. Cardiovascular system disorders. Preventative measures: control high blood pressure, healthy diet, exercise, and not smoking. Gastrointestinal system disorders. Malignancies, peptic ulcer disease, bleeding, and pancreatitis. Colorectal cancer, second to lung cancer as cause of cancer-related mortality. Early detection measures are very effective and increase survival. Gastrointestinal system disorders. Difficulty swallowing, dehydration, esophageal foreign bodies, diverticulitis, gastric outlet obstruction, hepatitis, gallstone disease, constipation, and fecal incontinence. Genitourinary system disorders. Incontinence is the most well known. The number of nephrons in kidneys decrease, which cause normal dose of medicine to be an overdose in elderly. Acute and chronic renal failure, not uncommon in elderly. Incontinence, caused by changes in the bladder capacity and muscular structure, leads to social and hygiene concerns. Genitourinary system disorders. Benign prostatic hyperplasia, BPH, is common in men over age 70. Enlargement of the prostate gland that can obstruct urine flow. Prostate cancer is the third most common cancer in males. Over 80% of tumors are found after the age of 65. Musculoskeletal system disorders. Musculoskeletal dysfunction is a major cause of disability. Osteoporosis is the reduction in bone mass and density, 4 times more common in women, increased by the risk of fractures, kyphosis, degenerative joint disease, or osteoarthritis. Chronic deterioration of a joint cartilage. Obesity is a key risk factor as well. Musculoskeletal system disorders. Osteoarthritis is the second most common cause of disability in the United States. Symptoms equal pain, swelling, and decrease in range of motion of a joint. Degenerative diseases. Symptoms equal pain, swelling, decrease in range of motion of a joint. Arthritis is the cause for a lot of knee and hip joint replacements. Arthroplasty and/or hip surgery. As a technologist, there's a few things you should know. Never sit the patient up at 90 degrees who has just had hip surgery. Prevent from abducting their leg. No frog leg exposures. The leg must be kept extended. You may not bear weight for some time post-surgery, so you might have to adapt how you perform your x-ray. Nervous system. One of the most common causes of disability, affected by the degree of atherosclerosis, which is the blood flow to the brain that affects tissue damage, slow motor and sensory tasks, increased risk of falls, cerebral infarcts lead to dementia. Immune system decline increases the vulnerability to diabetes, pneumonia, and nosocomial infections. 3 general categories of illness that preferentially afflict the elderly are infections, cancer, and autoimmune disease. Immune system decline. Prevalent infections of aged are influenza, pneumonia, tuberculosis, meningitis, and urinary tract infections. Hematologic system disorders. Anemia is primary concern. Symptoms of anemia: pale skin, shortness of breath, fatigue easily, caused by insufficient dietary intake, inflammation or destruction of GI lining to absorb vitamin B12. Endocrine system disorders. Diabetes is the most common age-related endocrine system disease. Non-insulin dependent type increases in frequency with age. Regular exercise and weight loss reduces risk and delays onset. Elder abuse. You have several types: neglect, mistreat, and exploitation. 1 in every 20 seniors experiences elder abuse. Abusers are family members, caregivers, strangers, men and women. Elder abuse may involve physical abuse or violence, sexual abuse, emotional or psychological abuse, isolation or caregiver's neglect or self-neglect, and financial abuse. 3 subcategories of elder abuse are domestic elder abuse, institutional elder abuse, and self-neglect or self-abuse. Patient care of elderly. Some quick tips. Take time to educate the patient and family. Decreases the patient's stress and anxiety. Increases compliance and satisfaction. Speak lower and closer. Reduce background noise. Treat the patient with respect and dignity. Communicate with warmth, empathy, and a positive attitude. Patient care of elderly. Some more quick tips. Provide rest time between projections and procedures. reduce vertigo and fear of falling. Avoid using adhesive tape. It can easily damage the skin. Use the table pads and handrails to increase comfort and compliance. Patient care of elderly. More quick tips. Provide blankets, sponges, and other positioning aids. Increase comfort and reduce the risk of pressure-related injury. Patient care of elderly. More quick tips. Carefully check your patient's history before contrast administration. Reduce adverse reactions such as dehydration, induced kidney failure. Assess for swallowing difficulty. Administer drinking liquids in the upright position to reduce the risk of aspiration. The Joint Commission criteria. Age-specific competency for all healthcare professionals are required. Age-related care specifics include assessment of visual or hearing impairments, digestive and esophageal problems, grief concerns, professional of warmth and safety aids. Joint Commission criteria. Appropriate age-specific communication skills are required. Knowledge of age-related changes and disease processes assists radiographers in providing needed care to the elderly. The radiographer's role: to adapt procedures to accommodate disability and disease, understanding of physiology and pathology of aging, the awareness of social and psychological, cognitive, and economics of aging. When positioning for a chest X-ray, what are some ways to help our geriatric patients? Radiographic positioning for geriatric patients. For a chest X-ray, for PA, wrap their arms around the upright device to increase support and security. Provide a support and stability in moving arms up forward for the lateral. Perform an examination in a wheelchair and note the change for the radiologist. Hyperkyphosis changes positioning landmarks, so be aware. Radiographic positioning for geriatric patients. Spine. Use sponges and a table pad. Upright more comfortable for those who are able. Seated position may be used for examinations that require an upright position. Radiographic positioning for geriatric patients. Pelvis and hip. Fractures are common. Do not rotate the limb until the fracture has been ruled out. Cross-table laterals more often comfortable for the patient and easier on a technologist. In non-trauma patients, sandbags are useful to support rotation of limbs. Radiographic positioning for geriatric patients. Upper extremity. Limited flexibility and mobility present positioning challenges. Contracture of limbs caused by stroke must not be forced the patient into position. Sponges and sandbags and use of cross-table projections may be useful. Radiographic positioning for geriatric patients. Lower extremity. Limited flexibility and mobility present positioning challenge. Perform images in a chair. Exams such as feet, ankle, lower leg can be performed in a wheelchair. The tech might have to think outside the box. Cross-table projections reduce the need for transfer. And that's an injury to the patient and or yourself. Radiographic positioning for geriatric patients. Technical factors have to be adjusted to accommodate disease and normal age-related changes. To make correct technique adjustments for the disease and age-related changes, radiographers must know whether the disease is or change is an additive or a destructive disease. When positioning the elderly, what are some things you can do as a technologist? Radiographic positioning for geriatric patients. Exposure time critical. Shorter times reduce the risk of imaging involuntary and or voluntary motion. Elderly may have a difficulty maintaining a required position. Breathing instructions must be carefully communicated and practiced. The end.